Hello, this is Dr. Stanley Lang, and welcome to this video. And this presentation is continuing the topic of whole person health. That's health of body, mind, and spirit that I have been presenting on for some time. And the concept is that the integration of health of body, mind, and spirit is the highest chance, brings the highest chance, I think, to optimal health. And the focus today is on depression and spiritual health. Depression and spiritual health. And so let's talk a little bit about what depression is and what spiritual health is. So depression, I'm not going to go into a lot of definition at this point, but everybody has experienced mild depression as part of what we go through usual days and weeks. Our moods swing upwards and downwards. Energy levels go up and down a little bit. So all of us have very mild depression, occasionally at least. When somebody is impaired enough, though, that they actually seek help in a doctor's office, they're no longer mildly depressed, or they're at least mild to moderate depressed. And I saw a patient yesterday who is very helpful to illustrate a major principle that I think it's important to wrestle with when we are dealing with either depression or anxiety, or a combination of both. And if you've never been depressed, you probably have had anxiety. So this particular person has wrestled with depression before, had been treated, and started to get worse again. And his depression expressed itself as having no interest at all in any of the things that usually were important in his life. And also, he didn't really care about people that he was usually cared about. In fact, he was afraid that his anger was going to blow up and cause him the loss of his job. I asked him whether his spiritual life was important to him. He immediately brushed it off and said, no, not at all. And it was clear from his comments that it wasn't something that he wanted to investigate in any way either. So I really did not investigate that with him, but I want to illustrate why that should have been a really critical part of his treatment. And so the reason that there's this overlap between depression and spiritual health is that much depression is from wounded spiritual health. Now, what's the connection? Well, in my experience, the connection is unforgiveness and resentment. Now, all of us know what getting angry is like. Many of us don't admit, though, that we move quickly from anger to resentment, and we move quickly from resentment to a state of continuous unforgiveness. And when we are dealing with unforgiveness, most people just bury it. Some people wear their anger towards the other person on their sleeve all the time. Depends on your personality type, but most people just bury it. And so a lot of folks, maybe most people, are going through life with a lot of buried unforgiveness. And so they're just angry at various other people. They want revenge at some level in their life. And this continuous anger and I want revenge, at least a part of me wants revenge, causes a severe expression of the chronic stress response. It makes us sick. Literally, depression makes us ill. Depression and unforgiveness has been likened as wanting to kill the other person, but drinking the poison yourself. And literally, when we are in this state of unforgiveness, we're not usually hurting the other person, we're hurting ourselves. And so how you get out of unforgiveness, well, there are some ways to kind of work your way through it with some mental tricks. But it's been my experience that it is only through the spiritual life and a healthy spiritual life that you really work through unforgiveness. And if you don't do that, you're not going to ever get over your depression completely. And you might decrease it some. You might go through years of counseling. You might get some relief from some of the medication, but complete healing isn't going to happen if unforgiveness is at the root of it. So I don't know that unforgiveness is at the root of your depression, but I heard an interesting interview many years ago, which has stuck with me. That's at least 25 years ago. And this was an old minister who is retired now, and he was talking to the interviewee, and he was saying, you know, when I entered my ministry and all the people I would counsel, I came to conclude that at least 25% of people that were depressed, that it was because of unforgiveness in their heart. And then he said, and then as I got more into my years, years in the ministry, I really came to realize that at least 50% of the time when people were experiencing depression, that it was because of unforgiveness that was in their heart. And then he said the most powerful statement. He says, now that I've looked at my whole ministry and I look back at life, I'm convinced that 100% of the depression that I saw in people was because of unforgiveness in their heart. Now, I'm not going to try to prove that that's true, but it is my observation that most of the time, unforgiveness is at the heart of depression. And unforgiveness is a spiritual disease. It's not an emotional disease. It has emotional ramifications and expressions. And in my experience, the best way to understand forgiveness is through the lens that Jesus gives us as he's dying on the cross. He's giving everything completely. He's suffering in the most unbearable way by bearing all of the sin of every person who would ever live. All of the punishment that they would ever experience is on his shoulders at the moment that he says, Father, forgive them. They don't know what they do. And I'm nowhere near forgiving as well as I should, but I encourage you today, and myself again, to work on forgiving as soon as possible. Don't bury it. The moment that there's anger, there's probably resentment. The moment there's resentment, there's probably unforgiveness. So I wish you well in experiencing the grace of forgiveness, especially God's forgiveness for you, so that you can extend that forgiveness to other people. I wish you well. God bless, and have a great day.